Good afternoon, everyone. This session is going to just be sort of a discussion with 4 Iowa public transit systems who were very instrumental in continuing to get their agencies moving forward during some very uncertain times, such as what we call the pandemic. And so I will be asking them some questions, and we're just going to have kind of a conversation. And if you have questions as we move along, just put them in the chat. Danny will monitor that, and we will answer those as those come up. First off, I'd like to make sure that everybody gets introduced. So we have 4 very distinguished public transit staff. We will start with Randy Zobrist. Randy, just introduce yourself and tell people where you're from.
Good afternoon, Randy Zobrist, Riverbend Transit. We're a regional system, 4 counties based out of Davenport, Iowa.
Cindy.
I'm Cindy Voss, Chief Operations Officer for Rides. We have 9 counties in the far northwest part of the state.
Thank you. Mark.
Hi, I'm Mark Lander. I'm with Southwest Iowa Transit, and we run Southwest 8 counties in Iowa.
Mark, you're not very loud. Could you talk a little louder?
Yeah, hold on just a second. Is that better, Julie?
Say it again.
Is that better?
Can everybody hear him?
How about that? Does that work better?
Yeah.
Okay, yeah. I'm Mark Lander. I'm with Southwest Iowa Transit, and we run the Southwest 8 counties in Iowa.
Thank you. And Barb.
Hi, I'm Barb Neal, so I'm the transit director here at CyRide. So we serve the city of Ames and ISU.
Okay, thank you. Okay, so the first question that I'm going to throw out to everyone is what worked and what could have worked better during the pandemic to get people to essential jobs, testing, vaccines, and all of the places that they needed to go. So Barb, I'm going to throw that out at you first, since I see your face right there.
Okay. So let's see what works. So obviously urban system, so a little bit different than maybe a few other people here. So I think really the biggest barrier during the pandemic was really that uncertainty, people not knowing how full their bus might be or how it might affect their health. And so I think that's where we all learned the new word social distancing, which nobody thought would be in their vocabulary. So with people being probably more sensitive to social distancing, and we really wanted to look at tools that we could use to help address it. So for us, it was really our automatic passenger counter, so that people could view on their phones how full a bus was, so that then you could decide if you wanted to socially distance, or you could decide maybe you needed another choice. So we were able to get 2 grants to help fund that. So that's kind of, I guess, how from the urban side I would answer that.
That's great. Randy, what about you?
I think the thing that worked best for us, especially within the first 3 or 4 months after everyone's been cloistered in their houses, and then vaccines started coming out, was our relationships that we already had, but they were cemented even more through Area Agency on Aging, the county health department, community health, hospitals and clinics, in letting them know that people were going to be riding for free, and that regardless of their situation or their location within our service area, that we would be available in our normal business hours. We were fortunate enough to have all of our drivers who we could utilize were volunteering to, well, not volunteering, they're being paid, but were willing to work and drive and support our mission. So for us, getting people to the testing and the vaccines was working with those types of agencies, and we were almost exclusively those initially, and then the fixed routes kicked in after that.
Okay, Cindy.
I think I would champion a lot of what Randy said, very similar. First of all, the resiliency of our drivers and their willingness to drive really was without question. They continued to provide, those vital trips, the vital medical trips, the dialysis, and like Randy, our relationship with Elderbridge and our partnering agencies was strengthened even more in that, how can we help each other? What's the best way to continue to serve people? How can we get outlining people from out in the country or farther out in for vaccines, especially if they needed that transportation that was para. So those two things were huge. I think the thing that we would probably, with hindsight or review going back, is to maybe not have shut down as much as we did and continue providing even more transportation than we did at that time. But it was vital that we continue to do those medical trips, get people out for the vaccines and strengthen those relationships. We worked with emergency management as the hospitals began discussing how to do mass vaccine clinics. We've even offered our facility and buses in order to assist that.
Awesome. Mark?
Well, the pandemic, I think it was a learning experience for everybody. We shut down about a week, just a couple services. Besides that, we pretty much kept things running. We were able to keep routes running. We actually hosted Test Iowa in one of our trans facilities in Council Bluffs for about 7 months. And I think in hindsight, we should have pushed a little bit harder to have a bigger say in some of the public health, or I shouldn't say bigger say, but we should have been at the table with some of the public health decisions and discussions in our area. Not because we don't have a good relationship with the public health, but I think they don't really understand. It kind of goes unnoticed how much we do for those folks that are at risk and at need. And so I think we could have helped out a little bit more on, making sure those folks are taken care of just a little bit better in some of our rural areas.
Okay, so that's something that we need to kind of keep in the back of our minds when another pandemic happens, is we need to make sure that we're working more closely with public health. So what has changed and what will continue when it comes to safety of drivers and passengers? Randy?
Well, we didn't go to the lengths of cloistering our drivers behind plastic or behind barricades. We used the CDC protocols for personal protective devices, social distancing, no money handling, the sanitizing before, during, and after routes. But what has changed for us, and I think we've seen that industry-wide, is I think everybody's going to have an individual who is a service worker or a dedicated individual who is going to be cleaning and sanitizing vehicles going forward. My personal opinion is that we should probably have had this position for the last 30 years as well, just as a general public health responsible effort on public transit's part. So that position is forever cemented in our budget, and it also gives us the opportunity, gave us the opportunity to advertise what we were doing for sanitizing and protective measures, as well as what we were doing at the facility after the buses came back at the end of the day to our riding public, so that we posted that all over our buses, so that at least they knew behind the scenes what was going on, and that when they got on our bus, that it was going to be as sanitized and as clean as it possibly could be. So for us, that's something that we will continue going forward.
Okay. Cindy?
We did put plastic barriers up. They were a temporary system that our maintenance department put into all of our buses. They were a good and bad thing. I think there was some level of comfort for the drivers and the passengers knowing that it was there. It was also got to the point where for the drivers, they just really felt like it was more of a safety hazard for them to really be able to see, especially in the cutaway buses. So we removed those with CDC guidance and the ability to have that come down. I 100% agree. I am totally fine that I think everything is cleaning more, airport bathrooms being cleaned more and public places with a little more focus on our cleanliness is totally okay with me. And I hope that it continues moving forward. I think it did, really open our eyes to what are we doing and how can we help our community members feel safe. It was, I think, as everybody did, something that we focused on in trying to get people back onto the buses and a comfort level with that. We had a lot of conversations. We did work really closely with public health in all of our counties. They were awesome about getting our drivers in just as soon as they could to get them vaccinated, and worked with us about what can we do to make sure that what we're presenting is safe and accurate for our passengers and the drivers. I think moving in the future is something that's going to need to stay a focus for all of us. Who knows what a year or 2 years from now, if it's another pandemic that is more contagious, how are we going to be prepared to meet that? And what are those steps that we would put into place? So we have a lot of those conversations now. But again, hats off to the drivers who were willing to go the extra steps to clean and make sure that things were being disinfected and carry the extra supplies and wear the mask when they drove and it was uncomfortable, and especially when they secured individuals. And, we continue to ask people, even with the mask mandate being removed, do you want us to have a mask on when we secure your mobility device in the vehicle, because they're in such close proximity to make that happen. So I think it's definitely going to have an impact on how we work in the future, as it should.
Thank you. Mark?
We're like the rest. The cleaning was a pretty big deal for us. Pre-COVID, we did a lot of sweeping, and we did occasional mopping. I'd say probably every 2 or 3 weeks we'd mop the buses out. But we have hired on an individual to do our bus cleaning, and the sanitizing has been great. Not just for COVID, but the drivers like to have a nice clean bus. We do a lot of gravel traveling, so you get that dust in there, and it's not practical for a driver. And I mean, we don't make our drivers, mop the bus, sweep and pick up trash and that type of thing after routes. But it's nice, and they enjoy it, and they like to come in every couple of weeks and just get a real good deep cleaning. It's really risen our baseline cleanliness up. So drivers enjoy it, the passengers enjoy it, and it's been a good thing overall.
Great. Barb, what about fixed route buses?
Well, I would echo what everybody is saying. I mean, honestly, the buses were cleaned every night. We were fortunate enough, we didn't need to suspend any service or furlough anybody. How we got hours for our drivers is we sent them out to clean buses. So every 40 minutes to hour across town, the buses were disinfected. And I think that really helped educate the public that it was safe. We also were fortunate to have a aerospace engineer on our staff. So he did some airflow analysis. So he was able to talk about how quickly the air circulates through the bus, which I think also gave people kind of a sense that the bus is clean. And you saw a lot of Twitter responses and stuff about how people who were riding appreciated how clean the buses were. So I think that was nice. Again, I think we did a lot of the things. We did have the barriers. We actually still have the barriers up in the bus. We intend to take them down now that the mask mandate has ended, but we're kind of doing it maybe a little slower just to get people acclimated, because everybody kind of has a different sense of space and what they're comfortable with. I was trying to think. I mean, the other thing, again, I'll keep talking about the automatic or passenger counters, but for us, it really was a good thing because people still can get on their phone and look and see how full a bus is. So if you're somebody who has a medical condition or a compromised immune system, you may not want to ride this bus that happens to be full, and you could take the next bus. Not everybody has those same choices, but when you have that choice, I think giving people the power to make those choices was really important. And I think the other thing that helped with us, and maybe it's not so much about the safety, is we really did develop real deep partnerships with all of our hospitals, with our emergency EMS, our EEOCs that were activated. So I think well, I'm confident now that we really in transit do have a seat at the table. And if something ever did happen or gets worse in the pandemic, they certainly call us, rely on us to give insight. And I don't know that transit was recognized before this. Again, you don't want to go through a pandemic for that to happen, but I do feel like it has brought to the forefront the importance of getting people to medical appointments, essential jobs, healthcare workers, things like that.
That's a really good point, because there are so many that could not just stay at home. You know, the dialysis patients, the cancer treatment, the essential workers. So that's a very good point.
Julia, I've got something that I forgot to add as far as when we talked about working with the local agencies. Even though we're involved with our county emergency management for evacuations, emergency situations, they were extremely helpful in providing PPEs for us, whether it was masks, whether it was gloves. Initially, the hand sanitizer and all those types of supplies. They were instrumental in providing those to us at no or low cost. So I would have to take my hat off to our local Scott County emergency management, because they were very, very, very helpful. They would let me know when their supplies were coming in, if I was running low, and that really helped us stay stocked up. We never did run out of anything. Ran low a few times, but never did run out. So hats off to the Scott County Emergency Management.
That's awesome. So what changes, such as working from home, telehealth, etc., with the changes such as working from home and telehealth and things like that, how do you see this affecting transit ridership in the future? And are you, or how are you preparing for these changes? Cindy, we'll start with you this time.
I think, the first thing we have to do is reevaluate our metric for success. It's not going to be what it used to be. I don't think, we can sit down and say, when we get back to normal anymore. We have to determine what our new normal is and what that's going to look like for public transit in rural Northwest Iowa. And that's how are we meeting the community's needs? That's definitely changed. One of the things that we did just at the start of the pandemic, and it really just kind of flowed naturally, is we went to the CyRide account system. So we no longer are accepting cash or tickets from passengers when they get on the board. We're completely cashless now. It works very similar to like your college account or school lunch account. When you get on and ride, the driver hits arrive and pick up, it deducts that money from their account. When their account is low, then they put money in. So we're no longer exchanging money. So I think that's changing. I think we need to, as for rides specifically, look at how we're meeting the community needs. So working more with our elderly agencies and how can we service them the most, looking at more of an Uber face to some of those transportation needs when it's doctor's appointments. We don't typically know we're going to wake up and not feel well the next day. And we're also looking at a lot more employer transportation and are working with grants in order to provide that transportation for employees as they struggle to bring employees in. How can we meet that need by transporting large groups to their agents or to their organization for transportation? So we're doing that for a couple different organizations right now. And then I think we just need to take a look at, again, how do we meet the community's needs right now? What are they? And what's the best way to do that? Is, that may no longer be what it used to be. So it's defining our future in a different way. Absolutely.
Okay. Mark?
Well, I see the work from home. I see the telehealth. I see all of that as positive. I don't ever foresee someone being permanently work from home, but if someone's under the weather but they're like, I can still work. I'm just as a precaution, I want to stay home and work from home. I mean, that's something we have now, and I think that's wonderful. As far as telehealth, I think the majority of the folks we transport to appointments are still going to need to be seen in person, just due to some of their situations. I see a positive in telehealth as it actually might help keep our drivers and other members of the community healthier by, not having as much exposure to folks that might be sick, because they can have that telehealth option. And, I think that's it's a benefit for all our communities. If those folks that aren't feeling well are able to do the telehealth option instead of getting on a bus and riding with 3 or 4 other people and kind of exposing them to, something that they shouldn't or, won't necessarily have to be exposed to now.
Thank you. Barb?
Sorry, had to unmute. So I guess from the fixed route perspective, I guess I would echo what Cindy said. It is kind of this, as we kind of adjust to whatever this new normal is. I think what we have found is true is that the way people think about full buses is different from our perspective. People socially distancing, their personal space is different. But I mean, while working from home is great, that's not always an option, people still have to go to medical appointments. So I think it's important that we continue to make people feel safe and encourage them to use public transit. I think continuing to keep the buses clean, making improvements to customer service, ease of access, like Cindy said. I mean, the cashless fare is a really great idea. I mean, 93% of our riders are students, so ours is essentially cashless. One of the things we're looking at CyRide is doing a more of a demand response kind of management software so that we could have a flexible service, a little bit more flexible service, so people could self-schedule their rides, things like that. So, well, I think working from home is a good idea. Telehealth obviously is good. At the end of the day, I think transportation is always going to play a role in people's what they need. I mean, not everything can be telehealth. So not everything can be working from home. So I think it's just being there and redefining again what excellence looks like.
Randy?
Well, I just jotted down the 3 things that are probably going to impact us now and going forward. Is I don't anticipate probably recovering at least about 20% of our former rides. Those are probably gone because of the trends that we've seen. And again, when we're talking about working from home, not necessarily a majority of our riders, but when we've got many of our elderly and disabled folks who have discovered that many retailers will be providing delivery to their home for groceries to medicines, where they used to book a trip with us to get to the local pharmacy. They can get that at home now. So those types of trips will be gone. But as Barb said, the other 2 things that we're going to be doing is we're looking at a different software that will allow that on-demand type of scheduling by the rider themselves. I think that will help at least maintain, if not help increase some of our ridership. And it gives them more flexibility as well, whether it's the individual or an agency or a caregiver. We might be able to recover some of that 20% that I think might be lost. And then looking at right sizing our vehicles. COVID definitely showed us that running around town with 18-passenger buses is not necessarily the most efficient, effective, or even necessary size vehicle in most cases. So we are looking at downsizing the capacity of our vehicles probably over the next 5 years to get a better balance of smaller capacity vehicles that are more efficient, more cost effective to operate.
Good point. Okay, and then what is one thing people need to know and or actions they could take to help in eliminating transportation barriers to healthcare? Mark, I'll start with you this time.
Well, I really like what you guys had heard are doing with healthcare providers. I'd like to see healthcare providers play a bigger role. If healthcare providers are educated on our capabilities and peak times, I think it'd help them schedule individuals that they know have transportation issues during times that would allow public transportation, at least in our setting, to play a bigger role. So I think that's really critical, and that's going to be a focus that we have as well in the next 12 to 18 months.
Awesome. Barb, let's go with you.
Let's see what we need to eliminate transportation barriers. I think most of the systems went free during COVID. So I think the cost of the ride can be significant and can certainly be a barrier for a lot of people. So I think systems trying fare free might have been good in the long run. I know we're going to look at a fare free option to see if it's plausible in Ames. I'm not sure if it is, and try to improve equity and access. I think the other thing, leaning back into the automatic passenger counter project for us, I mean, really that started out really just to help us manage loads. I mean, it was something we had in our program, but we were fortunate enough to get a COVID-19 research grant and an Iowa Developmental Disabilities grant. So it gave our passengers really the tools I think they need to kind of connect to the things that are important in their lives. But I think the bigger thing is that it really helped create equity and access to opportunities, because maybe you could see where the bus goes, you have a better understanding. So from the fixed route perspective, I kind of feel like that's probably what we need to continue to move into so that we can eliminate those barriers. What are we doing so that everybody has equal access?
Awesome. Cindy?
Sorry, I needed to unmute as well. You know, I think as I'm listening to these guys and I look back on the past 2 years, I think that, you know, one of the amazing things for us is that we are this best kept secret. I mean, I think if I stood on the corner in Spencer on 4th and Grand and said, what does rides do? They would tell you that we serve the elderly and the handicapped, and that would be it. That would be their vision of what we do. And while that's 90% of what we do, and it's vital that we do that very well, for the public to understand that they can call the bus and use it is really limited. You know, we're close-knit family communities in Northwest Iowa, and you know, when your car breaks down, you think of calling your coworker, your spouse, your friend, your neighbor. You don't think about taking public transit. It serves a much different face than Barb has in downtown Ames, where it's easier to get on the bus than it is to drive your own car. So I think for us, it's really just partnerships and communications and continuing to let people know that rides exist and we're there. And then at the same time, not losing the proficiency and excellence that we do when it comes to providing individuals that require paratransit and those individuals that can no longer drive or have been asked to no longer drive. You know, so much of what was said earlier today about what that communication does or that partnership does for the individuals that we transport. You know, we'll have individuals get on the bus and ask to just ride around for an hour because they're lonely. You know, they'll just say to the driver, is it okay if I just stay on the bus for an hour or so? And we let them, because that becomes their outing for the day. That becomes their connection with the community. It becomes their time to get out and see their neighborhood and, you know, just talk about their family or other things with their drivers. I think we often forget in transit how important we are to the people that we transport and what it means to them and how it empowers their lives. And, you know, I had a lady say to me one time, she'd leave her money to my drivers if she could, because they were nicer to her than their family. So I think, you know, it's just continuing to build those relationships. We've started to do transportation for one of our local community colleges. It's continuing to let organizations know that we can help and transport their employees when they're seeking to bring, you know, the community doesn't have enough employers out there for them. So how do we bring them to them, and continuing to have those conversations? And you know, it's just for us, I think my challenge is how do we communicate that with our rural populations, and how do we get the members in our little tiny communities into the larger city in that community that we serve, and how do we continue to do that and continue to grow, take what we've learned from this pandemic to move us forward, and like Barb said, continue to provide that excellence, and at the same time maybe reevaluate what our matrix is for success, because it's no longer going to be transporting large group of individuals from a work activity force home back to their group home. You know, it's a totally different face now, and what's that look like, and how do we get to be really good at it?
Great. Randy?
I have to agree that we have created our own barriers. I think over the years we've been so parochial and consistently inflexible because of operating efficiencies and group trips and costs. I think that, and what we see more in our urban services, is that the pre-scheduling a trip a week from now to go to the doctor's is going to is not going to be a favored means of getting your transportation in the future. I think we're going to have to adapt to that on-call, will call, on-demand type transportation to be able to meet those demands. And that would also help us meet those demands for folks who are not our traditional and typical riders. So I think from a standpoint of barriers to healthcare, for us, that's an area that we need to really reassess and take a new look at how we're going to provide service in the future.
Thank you. So those are the 4 questions that I had for the panel. However, we have some time, so I'd really like to open it up to the attendees to ask if you have any questions for this elite panel of transit providers. There is one comment question in the chat. It says, given what we learned earlier about the important mental health needs for socializing and community involvements, does this pose options to use the bigger buses for non-medical trips, in other words, fun or recreational trips?
How do you say non-charter?
I know it doesn't have to be group trips necessarily, but the thing with public transportation is we are not allowed to put a preference on what trips are more important than other trips. Even though medical trips may seem like they are more important, the way that our funding works is they say all trips are important. You know, so we can't prioritize our trips into medical or recreational or fun trips. So, but Chris, do you want to elaborate on that?
Well, just as I was typing the chat, I think Cindy and Randy were addressing that, or Mark. I think there is an awareness of how might we use these buses for other than the medical trips, and totally agree with what you've recognized about the importance of this social connection of just a little trip to the grocery store can be the vital social event for a lonely person in that day.
Yep.
It's been sort of the heartwarming and heartbreaking insight that maybe a lot of us have learned in this pandemic. So I'm really glad to hear from these transportation providers that you get it. And hopefully in the area that I live in, the Story County area, that we can connect our people who are trying to improve things to what some of you already know. And maybe Julia, we need to lobby to change the damn rule that says how the funding can be used. If people are realizing and understanding bigger human needs, you know, it'd be a slow process to change, but maybe it's time to consider bringing that forward.
I don't disagree. I think this pandemic has taught a lot of us that we need to change a lot of things that we do, and we're more aware of things. And I think the federal government and the state governments need to jump on board with that. But you're right, Chris, it would be a long process, but I don't think that, I think it's definitely stuff we need to be talking about.
Great, thank you.
If a number, this is from Riverbend staff, if a number of the clients are disabled and others are not, can we take them to recreational events?
I would assume you could. I mean, I think there's lots of options really kind of touching back on that mental health. I mean, as we kind of all kind of roll out of this pandemic and get that to normal, maybe it is just educating people about things they can do on the bus, whether it's fixed route or door-to-door demand response. I mean, you know, can you go to a park? Could you get your United Way to work together, or your an aging group to work together, senior citizen center? Let's all get together and learn how to ride the bus so that then we can have more accessibility, or we can have more options, or we can go do something, you know, walk around Riverbend or something. Just there's options out there. I think we just have to be a little bit more creative. I think we're going to all have to do that just to kind of recapture some of those riders. I mean, a lot of our money is tied to ridership and operational efficiencies. And so it is going to be important that maybe it's not the same riders and maybe service looks different, but we do have to continue to make ourselves valuable and competitive and a choice. You know, I think Cindy makes a good point that, you know, if we're only viewed as what's for the elderly or the disabled, you know, how can we change that lens? You know, I think from CyRide's perspective, we're viewed sometimes just as the college bus system. I mean, we carry more than college kids, you know, so while they make up a large portion of our ridership, everybody else is equally as important, you know? So I think there's opportunities there. I think it's just, I mean, for us, the real struggle is, and I guess this isn't really about the pandemic so much, but as you start to rebuild ridership, having enough drivers is where we're really struggling. And I don't know if everybody else has recovered from that and it just happens to be a CyRide problem, or is everybody still struggling to get enough drivers so that you can put it back out the service that people want, or make it fun and it's not just certain trips?
Well, we know that everybody's struggling with with drivers, sorry. It's industry-wide, it's being struggled with, but there are quite a few people here in Iowa that are as well. And we just worked on a program with ISU through their MBA program. And it was about returning citizens, those that have been incarcerated and coming back out, to help fill the drivers' shortages. But within that, they contacted a lot of the systems in Iowa and got what their driver shortages were. So I haven't had a chance to really dig into that, but I'm going to have information that's going to show us what the driver shortage is in the state of Iowa, so that that's something we can kind of take a look at and kind of decide how do we go about making that better, because that is going to be a problem when trips, more riders start coming back. If we don't have enough drivers, we can't do the trips. We can only do what we can when we have somebody behind the wheel of a bus. So I will be sharing that later.
Perfect, thank you.
We have a couple of other things here. So Kevin out of Marshalltown says we transport a lot of veterans to Walmart, Hy-Vee, and senior citizen centers for their social needs. Thank you. I remember this program will take place around Perry and that there are plans to expand. With that in mind, how soon would we see expansion plans to other counties or cities, or is it a matter of how everything plays out? You know, we're just going to have to kind of wait and see on that. The program in Perry starts July 1st, so we probably won't see anything expand to our other communities, at least for the first year that we're focused on the city of Perry. But I don't know that for sure, because some of it is just going to have to wait and see how popular that is. And then Brooke said travel training in our communities is so important. There is a stigma about who can ride and why you can ride. One way to address this is through communicating, outreach, marketing, and travel training. And then she put a link to HERDA's travel training program. Okay, so we have a little bit more time, about 10 more minutes. If there's any other questions, please either raise your hand or put it in the chat. Otherwise, I'm going to give Mark and Randy and Cindy and Barb a chance to give their parting thoughts, whatever it is that you want to say. And Cindy, I'll start with you.
Well, perfect. Thanks. You know, I just think a big shout out and appreciation to everybody that works in transit. You know, this has been certainly uncharted territory for all of us in the last 2 years, not just for us, but for our drivers, for our passengers, for our communities, you know, to the drivers and to the staff that just never missed a beat and kept going because of the service that we needed. You know, students needed to still get to campus, and people still needed to get to doctor's appointments, and dialysis had to happen. You know, through some pretty scary times, we maintained a constant. So I guess my first thought would be a hats off to everybody in transit that continued to do that. Hats off to that this conversation is even happening, that we are acknowledging that there is a need for people to feel connected again and get to those doctor's appointments and maintain our mental health at a time when, you know, suicide and mortality rates because of people's loneliness is, you know, something that really needs to be a discussion. And that, you know, as Barb said, you know, it's great that we now have these partnerships and we maybe have a better seat at the table. You know, I champion what Randy said as well, that we, you know, we need to continue to have those partnerships with our emergency management, and we need to be coming to the table with what we can bring to the community, and that communities that have transit thrive. And it's vital that we continue to do that. You know, I think Herta's video on how to ride is great. You know, we kind of took that and went out to some of our nursing homes and area agencies and said, you know, let's bring a bus. Let's set up a time where people can have what is it like to ride a bus? And, you know, many people said, gosh, I had no idea that, you know, you were that capable of transporting my mobility device. Now that I understand you can, you know, I love it and I want to go. Even adult children that were like, well, I didn't know that, you know, you just hear my parents. I didn't know what that face of that looked like. So just, again, that communication, so that people are aware what happens in urban and in rural places with transit. And the dedication of all of you is to be applauded, and to the drivers. And it is, you know, hard to do that, you know, but supporting drivers is vital, and, you know, helping them stay feeling appreciated. And I think we've all looked at different ways to do that, but I think that's key. You know, if we don't have the drivers, we don't have the service, we don't have transit. So they are the heartbeat of what we do. So thank you to all of you for this opportunity. I feel like you got the B team. Hugh had to be gone last minute today. So I learned last night that I was going to be sitting here today. So I don't know that I was as near as informative as he might have had the opportunity, but thank you for your grace and listening to me. And thank you for what all of you do.
Thank you. Kelly, did you have a question?
Hi, Kelly Angel with the Iowa Cancer Consortium. I did. It was actually about staffing shortages and drivers in rural communities, especially our rural transit agencies. But you kind of touched on that, so I put my hand back down. But thank you for kind of touching on that, and I look forward to, you know, the discussion coming up if there's any more comments on that driver shortages.
We will keep you in the loop. I think Mark hopped off. So Randy, what are your parting thoughts?
Well, the challenges that COVID brought to us, I think, were, for the most part, a blessing in disguise for those of us that are operating transit. And if nothing else, it made us take a hard look at how we do our business. And is that the way we're going to be doing business going forward? And I think to a transit system, no, we're going to have to make some adjustments, and they're not without some pain, but ultimately it's going to be better for our communities. And when you have a system that goes from 1,000 rides a day down to, I think we had 48 on a Tuesday in April of 2020, it really gets your attention as to, you know, there's some significant things that can happen, and we need to be better prepared for them. So I think that we have had a good learning experience. It certainly tests your esprit de corps at your agencies, but more than anything, for us, it's really made us take a hard look at ourselves and how can we better serve our communities. And the trends that we are facing now are going to be with us for a while. So it's a good thing, but it'll be a transition that we're all going to have to work closer with our fellow agencies, constituent groups, especially our riders, their caregivers, to be more focused and to be more available, and to try to balance costs and efficiencies along with the service side of things. So across the country, I think it's got all of our attention, and it's just time for a reset.
Very well said. Okay, Barb.
I wish I had some great parting words of wisdom like Cindy and Randy really did say a lot of it. I mean, just thank you for having us. I think as we move forward, it's going to be critical that we continue to be flexible and open to change. I mean, we know there's a new normal. We'll all recapture riders at a different rate, probably won't ever return to what it was pre-pandemic. But what does that look like, and how do we continue to provide the best service that we can to the communities that we serve? And I think the other thing I learned is that there's a lot of great transit systems out there, and we're very resilient no matter who you are. I think the pandemic proved that. So I'm confident in Iowa's ability to rebound from this. I mean, it may not be always the prettiest, but I am confident that we'll do it. So hats off to everybody and all the drivers and everybody who made getting through the pandemic, or as far as we are, possible. So thank you.
Okay, thank you. So Mark said he was having some internet problems and just wanted to thank Herta for hosting this great event. I can't say enough about the public transit drivers and professionals in Iowa, a really passionate group of folks that care about their communities. So he didn't just hop off, he probably got booted off. Anyway, I thank all of you for attending this event and for participating in this panel. I think there was some really good discussion, and it really does show that, like Barb said, transit is really resilient. We care about the communities that we serve. We're looking at how we can do things different. You know, like Randy and Cindy alluded to, we are looking at resetting what our services used to look like to what they're going to look like. So as bad as this pandemic was, one thing that public transit did was use it as an opportunity to figure out how we could do things better and start meeting the needs of the people where they are. So thank you again, everyone. Danny, I'm going to let you hop on and introduce whatever's happening next because I don't have an agenda in front of me. So anyway, thank you, Barb, Cindy, and Randy, and Mark. And I will see you guys later.